Jorquez, thanks. Let's bring in Dr. Annalee Baker. She's an associate professor of emergency medicine at New York University's Grossman School of Medicine. Dr. Baker, thanks for joining us. More than 90% of counties in the U.S. right now are experiencing high or substantial coronavirus transmission, but not all counties have the same level of vaccination. So what are you seeing right now in New York?
Well, thank you for having me. We are certainly seeing an increase in cases, both among pediatric patients and adults. It is still largely a pandemic of the unvaccinated, as we have heard, but even among our workforce, which has been largely vaccinated, we are also starting to see breakthrough infections. Typically, the infections that break through in the vaccinated individuals are not nearly as severe, which is why, although we are seeing more cases now than we were seeing per day last summer at the height of our surge in the summer, we are also seeing less hospitalizations and less deaths. Doesn't make it any less serious or less impactful, but we are certainly concerned about what is to come in the next month or two.
Doctor, the White House says coronavirus vaccine requirements in the U.S. are, quote, gaining momentum. Do you believe these mandates are necessary, and is there a better way to reach people who are vaccine hesitant or resistant?
Well, I certainly think they're necessary and they're a positive step in the right direction. You know, people are fighting these mandates and acting as though it's something new, but we have to recognize that vaccine mandates are something that's been around for a very long time. The U.S. military has been mandating vaccines for over 200 years. We have all 50 states with vaccination requirements for school children. And certainly this is not a new concept. It's just a new vaccine and certainly a newly politicized environment. The vaccine mandates are helpful. We're seeing this now in the private sector and the public sector. States, as we heard, such as California, Virginia, we're seeing it in New York City, the federal government starting to institute mandates, and even the private sector, companies like Tyson and Uber and some of these companies, and including universities, are leading the way. I will say that if you poll unvaccinated and vaccine hesitant individuals, they will still tell you that only 1 in 10 will state that once they are given a mandate to, let's say, get the vaccine or not go to their job or not go to a concert, they will still, only 1 in 10 will state that that would change their behavior. I do think that that number might change when people start actually facing what they're going to lose if they don't get vaccinated. Of course, there's the carrot and the stick, and we've seen that some of these incentives, from cash payments to lotteries, don't seem to work very well. So we're hopeful that some of these mandates will have an impact.
Well, Doctor, the FDA is expected to authorize a third dose for immunocompromised people. The CDC is meeting Friday to discuss the issue. So what still needs to happen before experts can officially recommend a booster shot for those vulnerable populations?
Well, I think that all of us in the scientific community are fairly in agreement that immune-compromised individuals need, deserve a booster shot. We are waiting for the gears to turn and for the FDA to approve it. But certainly the CDC appears to be on board, and those of us on the front lines have seen that immune-compromised individuals are not receiving the same level of protection as those of us with intact immune systems. Seen that immune-compromised individuals are not receiving the same level of protection as those of us with intact immune systems. So it's just a matter of waiting for the FDA to approve something, and we're hopeful we'll hear possibly as early as tomorrow that this has been approved.
Dr. Annalee Baker, thanks for your time.
Thank you so much.